Welcome to Families in Action on your local hometown station, AM 1220 KHTS. I'm Cary Quashen. I am your host, but I do not host this by myself. I got my co-host, Michael Doherty, but we don't call him that here. We call him, guess what? But guess what we call him, you guys? Look at his hair. What do you think? The Silver Fox.
Oh, figured.
This is the Silver Fox. He's my co-host. And hey, Mike. Families in Action is brought to you by your local hometown station, AM 1220. We're almost we're our 13th year.
We are.
And that's very exciting. And also by Action, which we appreciate. Thank you, KHTS, for all that you do for us and all that you do for the entire city of Santa Clarita. And also by the Action Family Counseling, which is alcohol and drug rehabilitation centers that we own and operate. We have inpatient, outpatient, and all-around patient care when it comes to that. And then the Action Foundation, I'll let you talk a little bit about that.
Well, Cary, you have a lot going on with the Action Foundation. In fact, we're going to be promoting something, and we might as well just go ahead and do it now because the Action Foundation is sponsoring the SCV Drug Take Back. And this is actually a lot of fun. This is Saturday, October 22nd, so you got some time to gather everything together, and it'll be 10 a.m. to 2 p.m. right out front of Henry Mayo. You can't miss it. This is great because there's no questions asked. You just drive up, get rid of the drugs. They're put in a box, and the Sheriff's Department, the DEA, actually disposes of it. So we don't even have anything to do with that. But this is sponsored by the Action Family Foundation, by KHTS AM 1220, your hometown station, by Henry Mayo Newhall Hospital, and the SCV Sheriff.
It's very cool, and it's a safe way to get rid of the drugs. Because people all the time ask me, how do I get rid of them? Well, you don't want to flush them down the toilet. It's definitely bad for the environment, and you could be eating your halibut and getting loaded at the same time. Not a good idea.
Not a good idea.
But you don't want it's bad for the environment, and you don't want to throw it away because somehow it gets into people's hands that it shouldn't. So this is a safe way to do that.
And it's very popular. We fill boxes and boxes and boxes filled with all kinds of drugs for all kinds of reasons. Or we've had people show up that said, I had somebody in my family that passed away, and we have all of these cancer drugs that we want to get rid of now. We have other people that are coming that have all kinds of medications in their medicine cabinet. Maybe they've even thrown them in their garage.
Yeah, a lot of pain medications and all that kind of stuff, or expired medication. It's a safe way to do it. They get incinerated.
They do.
The DEA takes them away, and they get burnt.
And we're going to be talking about this a lot between now and then, but once again, I'll just say it's going to be Saturday, October 22nd from 10 a.m. to 2 p.m. That's one thing that the Action Foundation does. Cary, you've got the free parent support group every Tuesday from 7 to 9 p.m. at Canyon High School. You are there.
I run it. I will be there. And we have two other counselors that deal with the kids, and I deal with the parents, and we deal with all teen issues, from substance abuse to peer pressure to self-esteem to cutting to anything. So if you think there's a problem with your kid, bring them.
And if you're out there saying, I just feel so alone in this struggle, this is a great way to get some support.
It is. I was talking to a mom on the way here, actually. I was telling her to come to group tonight. Her kid, she thinks, is using drugs. Anytime a parent says, I think my kid's using drugs, go with your gut. They are. 99.9% of the time. But she says, what if I see somebody I know? And I started laughing. She said, what's so funny? I said, if you see somebody you know, they're there for the same reason. So there's nothing to be ashamed about. And we're talking about substance abuse. And just briefly, I don't know anybody that doesn't know somebody affected by alcohol or drugs right now. And we're having an epidemic right now, and it's every hour 5 people are dying.
5.
Every hour during our show, 5 people will lose their life to an accidental overdose.
Now, Cary, we know
just like that.
We've been
5 people dead.
Wow.
We've been saying for a long time that it was 3 people every hour, but we also knew that we were using old
numbers.
statistics,
Right.
And now they've been updated. 5. That's a lot.
The numbers
129 people a day.
The numbers are higher, Michael.
Yeah, well,
this
sure.
still goes 2
Sure.
years ago. There's still statistics that are old.
Yeah.
They're always 2 to 4 years behind. And with the opiate epidemic that we're having right now, they're saying 5. I don't even want to guess on the real number of how many. And that's just accidental overdoses.
Well, I'm going to push you a moment. What do you think, Cary? 7?
I think it's closer to double.
Do you?
I really
You
do.
think that much?
Yes, I do. Absolutely. And that's
Wow.
not talking other ways people die from using drugs.
Right.
Car crashes, just doing stupid stuff. You know, I mean, there's a lot of other reasons. Murders, jail. I mean, I can go suicides. I can go on for days. We just know that every hour, a minimum of 5 people just die by, oops, I blew it, and they're dead. So it's really something that everybody better be paying big attention to. And by the way, all drug abuse starts innocently. Period. It's always an accident. It's always innocent. And it ends up, these days, extremely tragic. You know, the other thing is, because it's such an epidemic, we have a month dedicated to it, don't we?
We do.
I'll let you talk about that.
Well, September, this is interesting because this year marks the 27th annual National Recovery Month. That's for observance of both substance abuse and mental health services. And this is all through SAMHSA, that organization. So this has been going on for a long time, but this is a chance for families to tell their stories about recovery, and this is a time for support. This is a time for learning. It's amazing. You know, Cary, I was going to say before we just jump off of this numbers game, every week it seems like we have, and I hate to use this word because it's overused, but we have literally shocking numbers to share with our listeners.
Yeah, it's pretty scary stuff.
It is. So anybody that thinks this is no big deal, wow, you're wrong. Yeah. And by the way, I wanted to mention one other thing with Action Family Foundation, and that's the Action Academy, because that's so special. Yeah. The free public sober school for local middle school and senior high school students.
It's pretty cool stuff.
It is cool.
Yeah, it's definitely pretty cool stuff. It's also Mental Health Month, and we just need to pay attention to everything. I was watching CNN this morning, and they were talking about a new statistic that really got me alarmed. Black males between 9 and 12, the suicide rate is jumping out of control right now. So, I mean, I'm just listening to these things, and it's like, what in the world is going on?
Well, locally, we know that our suicide rate is way up here locally.
I know, but can you imagine 9 to 12?
Oh, that's sad.
These are kids.
That's so sad.
So, yeah, so, you know, I was just thinking, and we're going to talk with you guys in a little bit, and sometimes life's hard, and sometimes it throws us curveballs, and we feel like the world's out to get us. But think about really what's going on. By the time we start this show to the time it ends, a minimum of 5 people will be dead from doing what you guys are doing. They'll just die. That's not including the people that go to jail, that hurt people, that do other stupid stuff. Then you'll have kids between 9 and 12 that are killing themselves. And families that have to deal with that. Imagine, I was speaking to a friend of mine today, that her daughter killed herself about a year ago. And you can just see the pain. So I guess if at the end of the day, I mean, you guys are sober, you're in rehab, I've got my life going on, Mike's got his, he's got his. It sure could be worse, couldn't it?
Certainly.
Now really think about that. It sure could be worse, but we forget that. You know, we always, I want it to be this, I want it to be better, I want a girlfriend, I want a car, I want a nicer job, I want more money, I want a house, I want to know what's going on with me, you're alive.
And then we have that really ultra important stuff like I want a blue car instead of a white car.
You have a blue car, Michael.
Well, I know I do. I'm just talking.
Do you want a white car now?
No.
Are
I'm
sure?
perfectly happy.
Are you
with
positive?
I have a Malibu blue car.
I'm just checking.
I'm very happy with my car.
Good. I know you are. I'm just messing with you. But really, I mean, I guess what I'm saying is we really do have a lot to be grateful for.
Well, a lot.
You know, I was speaking to another mom yesterday, wanted to come into rehab, and she says, I mean, it's not her. She wanted her son to come in, and she says, I don't have much longer. I got stage 4 cancer. I want to see my son alive. I'm just listening to this stuff, and it's like, wow. My problems, not so big.
Not so big.
Not so big.
As
Your
I said,
problems, not so big. Even though you don't know where you're going in this world or in life, not so big. Could be a whole freaking lot worse. We're not allowed to cuss on this, or I would have said something brutal. But it could be a whole lot freaking worse.
Our guests today are Alex and Jacob.
I know.
And we're going to introduce him in just a moment, but
You just kind of did.
you got to hear this. Well, sort of.
Sort of.
This came from Friday, this past Friday. It's called "This Is America on Drugs," and it was from CNN. Cary, listen, we just talked about how frightening the numbers are. Listening to this. In modern history, few things have caused such a sharp spike in U.S. deaths as drug overdoses. Epidemiologists in several states blame the increasing number of drug-related deaths on greater use of heroin and synthetic opioids such as fentanyl.
You know what pisses me off? I've been screaming this for how many years?
Long time.
That
Well,
it's come into epidemic, that we have a disaster happening, and now we're in it. Because I'm in the trenches, I watched this happen the last 10 years. It was just going and going and going, and I'm just screaming, hey, what's going on? We better do something. People are dying. Now, everybody's going, oh my God, people are dying. Yeah, they are.
and here it is. Drugs are the leading cause of accidental death in this country. Fatal overdoses surpassed shooting deaths and fatal traffic crashes years ago. For perspective on how fast drug deaths have risen, consider the sharp rise in heart disease in the early half of the 20th century. It took about 50 years for the rate of heart disease to double. It took drug deaths a fraction of that time. Now listen to this. Heroin-related deaths increased 439% from 1999 to 2014.
Saw it happening.
As of 2014, heroin-related deaths had more than tripled in 5 years and quintupled in 10 years. And by the way, if you're not familiar with quintupled, that means it increased 5 times. Now, in 2014, opioids were involved in 28,647 deaths, 61% of all U.S. drug overdose deaths, and 10,574 were related to heroin. The CDC notes a long-term increase in overdose deaths due to prescription opioids and a surge in illicit opioid drug overdose deaths are mostly related to heroin.
Someone just died. Between now and when we started, at least one person died.
Already.
Wow.
As I said, shocking stuff.
Our problems aren't so big, huh? Isn't that shocking?
It is. It's, as I'm reading those numbers, it seems almost fiction, but it isn't. And we also know that it's going up to 2015, so it's bigger than that.
Yes.
Those numbers are all much larger.
Well, until we get a grip on this opiate explosion and get a handle on the managed care and insurance companies to allow people to get treatment, it's going to get worse. It's not going to get any better. It's going to get worse before it gets better. People are screaming now, and they're screaming loud, but it's still going to get worse until major changes are made. And that, the deal is, drugs are never going to go away. They're going to be here. Doctors are going to write prescriptions. People are going to have pain. They're going to need painkillers. They're going to get them. People are going to abuse them and get addicted, and their drugs are still going to be there. So the only way we're going to stop this is a couple ways. One is education. We got to stop it at the root before it starts. One, and number two is we got to get the government to mandate some kind of treatment. Because and to somehow oversee the insurance companies that are denying people stay. So it's a real big problem that we have, and I'm gonna bring you guys in a minute, but let's talk about addiction for a second.
Okay.
We know addiction is a disease. Alcoholism is a disease. It's a disease of the mind and everything else, right?
Right.
But let's get rid of that. Gone. How does somebody become an addict? Y'all looking at me. How?
And
I'm going to explain what I'm saying. When we're young, we all have what I call contracts. Remember these? When I grow up, I want to be a what? What do you want to be when you were little?
Chef.
And you are. Well, kind of. Right now, you're incognito. What do you want to be when you were little?
actually a real estate agent.
Where are you?
I'm still working on my marketing degree.
Where are you? Where do you live?
I live in a rehab facility right now.
Because you're a what?
A drug addict.
And you're living where?
In a rehab facility.
Because you're a what?
I'm an alcoholic, a drug addict, and addicted to a lot more other things that you can become addicted to.
Now, when we're young, we have contracts, and the first thing is I want to be a chef or I want to be whatever you said, right?
Mm-hmm.
You don't say I want to be an addict. In fact, some of your contracts, I will never use drugs. Remember those? We
Yes.
all had them. All
I
of
don't
us.
know if I ever had that.
Well, most everyone does. I knew I wasn't because my dad was an addict, and I didn't want to grow up and be like him. So I knew that. And also, what is the first contract we break then? What is the first thing most addicts do? Cigarettes. 90%. And there's only 2 reasons somebody would smoke a cigarette today. There's not 3 or 4. It doesn't get you high, right?
No.
So the only reason it would be is it's to be cool, or because it's a learned behavior from home, right?
Right.
Here's what it used to say on boxes. It used to say warning, the Surgeon General warning, cigarettes might. Here's what it says on most packs today. The Surgeon General has determined. What does that mean?
It will.
Concluded it will.
That cigarette smoking causes, what does that mean? Cancer, lung cancer, emphysema. This is what it says on packs, right?
Mhm.
Or it says smoking contains carbon monoxide poison. One of those, or pregnancy, something. One of those 3 things. So my mother, she died 5 years ago. God bless her. I love her. Always will. I went to the doctor with her, and she had stage 4 cancer. And she said, how did I get this? He looked at her like this. He said, Esther, it says it on the box. Oof.
Wow.
So here's the deal. We're hanging out with all these guys. Somebody says, you want a cigarette? No. Why? Because you know you don't want to die of cancer. You're hanging out with your friends over and over. Everybody's smoking. One day, what the heck? You take your first hit. What'd you do? Broke a contract.
Take a hit.
Right? You did.
Yeah.
So how do you clean that up? It's only a cigarette. I'll never smoke pot. And you mean it. Now you're hanging out with all these cool people. Dude, it's only pot. It's natural. It's legal. God put it there. It's medical. Right? And you convince yourself, well, maybe they're right. You take your first hit. It's only pot. It's not a drug. How do you clean that contract up? It's only pot. I'll never what?
Like,
Use other
never-
drugs. And you mean it.
Mhm.
But you're still hanging out with all these other people. All those other drugs are called drugs of opportunity. You know what that means? You're going to be at a party. You're going to let your whatever down a little bit. What happens when you drink a little bit and you smoke a little bit of pot? What's the first thing that leaves? Your reasoning to what? To reason.
Yeah.
So you're at a party. Hey, try this. Oh, no, I'll never do that. A couple more shots of tequila. Try this. Well, maybe one hit won't hurt. And you, whatever it is, crystal meth, cocaine, heroin, whatever it is, how many times do you have to use those drugs to get addicted? Once. Why? Because it's a shortcut to the pleasure zone of your brain. Makes you feel different and better than anything you ever felt before. Now, how does somebody become an addict? Pretty easy answer, isn't it?
Mhm.
How? By using.
One time.
Makes you feel so good. How is something that feels so good bad?
Right.
So, does it sound like an accident to you? It does, don't it?
Sort of.
So here's what happens with people that go to rehab. They come to rehab. They've already broken all those contracts, right?
Mhm.
Everything's all screwed up. They come to rehab, they get sober, and they say, well, I'm a heroin addict. I can leave here and smoke pot. Why? Because I don't like it. Why do you want to smoke it then? They're trying to figure out ways to still figure out a way to stay high. I just can't use heroin. I can drink, I can smoke pot, I can use other stuff. What happens when they leave? Same thing. They start breaking their contracts, and I've been doing this 35 years. Almost 100% of those people with that thinking end up back or in trouble. Almost 100%. If it's 10,000 people, maybe 1 can do it.
And that's actually an easy space to be in where you can overdose and die.
Most people that I'm seeing that are dying are people that's been clean. They haven't been using for a month or 2 or 3 weeks or 3 days or 4, whatever it is, and they start using and their body can't handle what their mind thinks it can.
So they go back to the same spot they left off at.
They go back to the same spot they left off at. So those contracts, I mean, if somebody really wants to stay clean and not use and not die and not end up in and out of rehabs all their life, stop using, period. I haven't used any drugs or drank anything in 35 years. Think my life's messed up? I have hard days. I have hard weeks, even a hard year. But guess what? It sure beats the heck out of what I did 30-something years ago crawling into rehab. and watching the people that I see and love and care about die from drugs. So if you want, and I'm going to let y'all tell you a story when we come back, but if you want to stay clean, it's all about contracts. It's all about keeping them. And it's all about from here to here.
Cary,
Otherwise, you're going to go in and out of rehabs all until something bad happens.
Right.
Now, Cary, I know you know this, but our listener out there who's saying, okay, how much does this affect our country? There are 23 million Americans in recovery, and there are another 22 million with addiction problems.
That might never get help
That's a whole lot of folks.
because they don't want it.
Yeah.
There's a whole bunch of people that need what you guys are getting. They'll never get it because they don't want it. When we come back, we'll talk to you guys about what's going on with you. This is Families in Action on your local hometown station, AM 1220 KHTS.